Hi, I'm Bob Herbert. Welcome to OpEd.tv. The Affordable Care Act, often called Obamacare, has been derided in the most extreme terms by many politicians, commentators, and others on the political right. A Republican presidential candidate once called it, quote, the worst thing that has happened to this country since slavery. But how has this law, which has reshaped the way health care is delivered in the United States, held up in the face of more sober, rigorous, and much less partisan scrutiny? My guest, who has studied the law and its impact exhaustively, has written an article for Harper's magazine titled Wrong Prescription? The Failed Promise of the Affordable Care Act. She's Trudy Lieberman, who covers healthcare issues for the Columbia Journalism Review, where she is a contributing editor. Ms. Lieberman, welcome. Thank you for coming by. I appreciate it. You have a devastating sentence in your article that sort of sums up the thesis, and it says, having failed a substantial part of the population it was actually designed to help, the Affordable Care Act is also wreaking havoc on the middle class, much of which had good health insurance to begin with. Now, what's that population that was supposed to have been helped by the Affordable Care Act that's not being helped?
Those were people with very low incomes who would have been eligible for Medicaid had about half of the states decided to expand their program, as the law called for them to do. But the Supreme Court decision 3 years ago left it up to the states to decide whether or not they wanted to expand. And many states, particularly red states in the South and the Midwest, decided they didn't want to do that. And of course, that's left a lot of these very poor people without any options at all.
So what do they do for health care?
Well, many of them go without, which is what they always have been doing, or they go to community clinics and try to pay on a sliding scale. And of course, that may help you for very minor things, but if you need surgery or anything major, you are in the same position you were before the law was passed.
Then there were those in the middle class who had health insurance, in many cases pretty decent health insurance, and they were under the impression that they just would not be much affected by Obamacare, if at all. What happened to those folks? That's a very large population.
They were told during the debate on Obamacare that if you like the health insurance you have, you can keep it. And they were promised affordable quality health care, as I remember. And everybody was promised by the president that their insurance premiums would come down about $2,500 a year. Well, of course, that hasn't happened because the law was really never affordable for people, and it was never going to be, and I think the crafters of the law really knew this. And the middle-class people who had this good insurance are about ready to lose much of that good coverage when the Cadillac tax kicks in a couple of years. And that is a tax that their employers will have to pay. And that will mean that the employers, in order to avoid the tax, will drop good coverage in favor of more mediocre coverage in order to avoid the tax.
And what do we mean by these Cadillac plans? What are they, and who has them?
Well, they're really a misnomer, actually. A lot of people have them. They are people who've had good insurance. And they are people in unionized industry, people who work for universities, government, for old line organizations. They had the normal plan that most of the world had, most of the world in the U.S. had, and that was a typical plan that paid 80% of your costs and you paid 20%. But the 20% was not really a very onerous amount in those days, and they were major medical plans, and you didn't have really high deductibles, which is the case now. And so people had pretty decent coverage, and that decent coverage is going away for many, many millions of people, and most of them don't know that's going to happen.
And why is it going away?
It's going away because of a provision in the Affordable Care Act, which says that their employers, who were the major providers of this good coverage, will be taxed on the value of a plan above a certain amount. So employers, in order to avoid paying the tax, will be having lesser coverage for their employees.
So these folks who have these very good health insurance plans, these are valuable commodities. And therefore, since they're going to be taxed based on the fact that they're valuable commodities, the employers will be taxed. They're going to say, you know, well, we're just going to get rid of these high-end plans rather than continue to offer them. Now, isn't that essentially a philosophical issue where an awful lot of people have felt that Americans should not have these high-end so-called Cadillac plans? Can you explain that? I mean, why would there be any objection to that at all?
Well, a lot of economists have not liked those plans for a very long time because they thought they sort of distorted the taxes and they just weren't right economically speaking. But they did afford very good coverage, and when the Affordable Care Act was being debated, it provided an opportunity to try to take care of that problem that they saw once and for all. In other words, it brings everybody down to kind of a lower standard rather than bringing people up to a better standard, which the law did not do. The other thing that the Cadillac plan tax does is act as sort of a cost control mechanism. The Affordable Care Act basically has no serious cost control built into it. And as many people know, we have a very, very high-cost healthcare system, and the costs are not really going to come down all that much in the future because there are all these new technologies and things that really boost up the price of care. And so what's going to happen is that you need to put the brakes on the escalation in prices. So it was contemplated by the Congress and the people who advised them that if you make people pay more, they won't use so much of it, and therefore the costs will come down. And so we have to remember that the national health care tax is the volume of services, the number of services, times the price of the services. So if you do something to bring volume down, the theory is that the price of overall services will come down. Now, it's not clear that that really will happen.
But what is happening is that more of the cost of health care is being shifted onto the consumers, the people who need this health care. You mentioned that premiums are increasing. First, why are premiums increasing? And then explain in a little more depth what's happening in terms of cost sharing.
Well, premiums basically go up every year, and one of the major reasons is what the insurance industry likes to call trend, and that means what the medical trend, what the costs of care are every year. So that's always built into the premium. But there have been other features that have made costs go up, and one of them is that everybody can get insurance now regardless of whether they're sick or well. And in a private system like this, the way insurance companies used to make money was by cherry-picking the risks, which meant that they only wanted to insure people who were the healthiest and who wouldn't generate a lot of claims, and then they could make more money. But the Affordable Care Act, to its credit, actually put an end to that for people who had to buy insurance on their own. And that meant that a lot of sick people, and some pretty sick people, were coming into the risk pool, and that meant that the insurance companies had to pay out a lot to take care of them. So there's been some costs built in for that as well.
So this, as you've mentioned, this is a good thing. I mean, you should not deny people health insurance or health coverage because they're ill. That's been a preposterous feature of our American health care system. So that's been changing as a result of the Affordable Care Act. Right. But it seems like the consequences of that were not well explained to the American public.
Well, it's very hard to do that in a private system and have everything kind of smooth out equally. In the other countries that have national health insurance systems, this isn't a problem because everybody is in the risk pool. The healthy, the sick, the rich, the poor, the old, and the young, and there's this cross-subsidization going on within this gigantic pool of people. So that makes it possible for very sick people to get care at an affordable price. And when you have a private system like we have, it's much more difficult.
So in addition to premiums going up, people are facing higher deductibles now. Why is that happening?
Well, I like to call that the great cost shift, because what it does is shift more of the cost of care to the individual. And it actually is sort of a tax on the sick, because if you never use your insurance policy and you're healthy for the year, you're not going to pay the deductibles
Right.
and the high co-payments and co-insurance. But if you're sick, you are going to pay them, and those are very steep amounts. Again, this was another way to shove the cost to the individual, save the cost for employers and other payers, rather than to try to actually control the costs of care at the source. So the thinking was that if you make people pay more for care, they won't use so much of it, and they won't go to the doctor. And there is some evidence in the literature that they don't go to the doctor, and that they cannot discriminate between needed care and unneeded care with very poor consequences.
Now, there have been some unquestionably positive results from the Affordable Care Act. You mentioned that you cannot be denied health insurance because of illness. What are some of the others?
I think one of the best features of the Affordable Care Act is what it was supposed to do for Medicaid. And we do see that many, many people throughout the country are now getting coverage under the Medicaid expansion in the states. And that has been a very good thing. But unfortunately, we still have a subset of states in which people cannot get coverage. And these are people with very, very low incomes. I would call them the poorest of the poor, and they are basically disenfranchised from the healthcare system.
And that's been fundamentally political. So it's states with Republican governors that have tended to do this. Because of the Supreme Court ruling, I mean, there's no real leverage that the federal government has to sort of force them or encourage them to give Medicaid coverage. What is going to happen ultimately with these folks, and won't that drive up the cost of health care because at some point they're going to have to get health care?
Well, ultimately they are going to get some health care, and they will go to the emergency room and they will get episodic care, but they're not going to get care for chronic illnesses and some of the other things they need. And I think that the spokesman from the Hospital Association I talked to, and he's quoted in my story, is saying, well, we didn't get the number of people we were hoping. We were expecting to get more people into this pool, and that was going to help our hospitals out. They would have less charity care, less bad debt, and so forth. And he said that hasn't happened, and it's questionable what they're going to do about this down the road. I'm not even sure they know. What's going to happen to people is that they will just be left out. And I want to talk a little bit about Tennessee, where I have done a lot of reporting over the years and saw the problems that people in that state had getting care over the years. And what happened to them when their governor in the mid-2000s cut many of them off from TennCare, which was a state attempt to try to get better care and better insurance to more people.
TennCare was their version of Medicaid.
Yes.
Yeah.
Yes, it was. I think it still is.
Yeah.
They still call it that. And I interviewed several people in Tennessee, people who had coverage under Obamacare and people who are out in the cold. And I have to tell you, it was really sad to talk to these people because, you know, they were telling me their stories and there was really no immediate hope for them.
You wrote in your article that Tennessee has refused to expand the coverage of TennCare or Medicaid, even though it's been documented that this would be beneficial, not just for the people who would get coverage, beneficial for the state in terms of the economy and in other ways. You talk a little bit about that.
Well, the federal government was paying a large share of the cost of providing the care. Some of the hospitals were very much behind the expansion. There would be some job creation, some of the universities found, and so on. And so it all came down to just hard-knuckle politics. And even though the governor of the state was supporting it, the powerful people in the legislature were not. And their reasoning was that we will eventually get the kind of Medicaid program we want, which means it will be block granted. And as we know, a block granted program from the federal government is not the same thing as an entitlement. And what happens with block grants is that the state usually gets far less money from the federal government for programs. And there is a group of people who believe that will happen if the White House changes parties in next year.
Right.
And I think that's what they're waiting for in Tennessee and perhaps the other states as well.
Meanwhile, people are just lingering out there without health coverage.
Exactly.
Now, Obamacare was supposed to not just revolutionize health insurance, but health care in this country. So it was supposed to, we were supposed to see a decrease in emergency room visits as a result, for example, and an increase, a marked increase in preventive care. Have these benefits occurred?
We know that it has not helped emergency room use. And this is something I have found extremely perverse and have written about it for CJR. The hospitals themselves have been advertising for people to come to their emergency rooms. And many people probably remember the discussion during health reform and the comments that politicians made. We've got to pass this bill to get everybody covered because they won't use the emergency rooms. So what you have is many of the big hospital chains have started advertising to get people into their emergency rooms because it's a profit center. Emergency room reimbursement is very lucrative. So they want people to come in to their emergency rooms. And you see in many places where they advertise on the internet, or they have billboards, they have apps on cell phones, aiming to get people in. You know, the wait is X number of minutes if your kid is sick or whatever. And so that entices parents and others to come into their emergency room instead of somebody else's. So this kind of negates the whole reason for getting people the insurance. That was one of the major talking points. The other talking point was preventive care. And I can tell you how many times I heard Nancy Pelosi and other advocates support this preventive care. We've got to get people covered because they're going to get the checkups, they're going to get all this stuff, and then they're not going to be a burden on the healthcare system. And I mean, you know, on one level, that makes a lot of sense. It's intuitive that you catch stuff early and so on. But what has happened is that with these very high deductible policies and the high cost sharing that people have to assume, and we're talking here deductibles of $6,000 for families with silver policies and $10,500 for families with bronze policies.
This is over the course of a year,
Yeah.
so you have to pay that much before your health insurance actually kicks in?
Yes, exactly. So if you're carrying those kind of deductibles, you're not going to run to the doctor for your preventive care. I mean, some of it under the Act is covered, but some of it is not. So you may not actually take care of the things you're supposed to.
Essentially, you're paying for preventive care because you'd have to pay for the care, which prevents you from getting more seriously ill later on, but you haven't really seen any benefit from your health insurance if you're paying out of pocket.
Right, but some services are covered, colonoscopies for one, and that was written into the law. But there are a lot of other preventive interventions, a lot of checking things out that may not be part of the law, covered under the law, and people will be postponing them or have postponed them until they can satisfy the deductible. And I've had many, many people over the years tell me that that's what they do.
Right.
And that's even before Obamacare.
Now, one of the positives, maybe a big positive of the law, is that it provides subsidies for people who really can't afford health insurance. So these were the people who were doing without, just simply because they didn't have enough money. How well has that been working out?
Well, I think that part has been quite successful because 87% of the people last year got a subsidy. The average subsidy was about $263, something like that. Mm-hmm. And many, many people would not be able to afford a policy. But we have to be careful when we're talking about the subsidies. They are very generous to people at the lower end of the income scale. They are far less generous to people in the middle, and not very generous at all to people at the top. People with income of 400% of the federal poverty level can get a subsidy, but it's probably not very much. But people in the middle class are not getting very much. And that's people with median income, the median income about $54,000. people $60,000, people $70,000, maybe even $80,000 are not getting very large subsidies. And so it's going to be interesting to see as this thing rolls out in the next year whether people in those income ranges signed up in greater numbers.
So it seems like the middle class is really taking a pretty big hit here. There's the higher premiums for people who already have health insurance. There's the cost sharing shift more to the side of the consumers. There's the high deductibles, which is part of that cost sharing shift. And there's the very small subsidies if you qualify for subsidies. So other than sort of an idealistic approach, in other words, you're in favor of expanding health coverage for people who don't have it, there's not much in this for the middle class, is there?
Well, maybe the fact they can get colonoscopies covered.
Which I presume is why there's not more support in the polls for the Affordable Care Act, even though, it's been around for a while now.
About half the people still don't like it. Half the people do. And those numbers, give or take a few percentage points, have been pretty constant since the very beginning. And I think what's also happened is there's been some erosion. The polls are showing us an erosion in the number of Americans who believe it's the government's role to kind of supervise this, provide this insurance.
Well, there have been big winners, of course, from the Affordable Care Act, and that primarily means the drug companies and the insurance companies. Talk a little bit about that.
Well, the insurance companies, of course, have been very large winners. The thing that was always amazing to me is that during the debate, the insurance companies were demonized because everyone hates insurance companies. We've all had our stories about insurance companies not paying claims. So they were demonized, and that was a very good selling point, and it was a very shrewd move on the part of the supporters of the act to use that. But it was really sort of disingenuous because what they were really going to do is deliver millions of new customers to them. And that's exactly what's happening. Now, the drug companies did very well, too. And this was also a strategic move on the part of the president and others to sort of buy the pharmaceutical industry off early on because they have a lot of money and could fight you quite a bit. And so they were promised no negotiations under Medicare. I mean,
they couldn't negotiate the price of drugs, even though the federal government was buying in tremendous bulk.
Right. They couldn't have done that anyway because that was part of another law passed in the early 2000s. But that's something the drug industry is always worried about. So the Affordable Care Act made sure that wasn't going to happen anytime soon. And in return, the pharmaceutical industry decided that they would pay for some of the brand name drugs, at least in the donut hole for Medicare patients.
We're running out of time, but very briefly, near the end of your article, you asked the question, was the Affordable Care Act better than nothing? What's the answer to that?
Well, I said very reluctantly, probably. I think it would be, some people have benefited from it. And I think it would be very difficult now to take those benefits away from that sort of lowish income group that needs the subsidies to buy coverage. And they have been getting some health care they didn't get before. But I think the country needs something better. And I think we really need a more universal system. We need to get everybody into the risk pool with a way to control costs, because every other industrialized country has figured out a way to do that. And somehow we have to get back to that ideal.
Well, this is very interesting, and we'll talk about this more at some point. Trudy Lieberman, thank you so much for coming in. I appreciate it.
Thank you.
We'll be back in a moment with a final word. On an April morning in 2007, 32 students and faculty members at the Virginia Polytechnic Institute were shot and killed. 17 others were wounded. 6 months before that, a gunman lined up and shot 10 girls at an Amish schoolhouse in Pennsylvania. 5 of those children died. We've had Columbine, where 12 students and a teacher were murdered, and Sandy Hook, where 20 very young children and 6 adults were murdered, and more recently, the killing of 9 people attending a church service in Charleston, South Carolina. I could go on. Roughly 275 Americans are shot every day, and nearly 33,000 die each year as a result of gunfire. And yet, as a country, we have proved helpless to stem this murderous tide. Incredibly, the latest polls show that increasing numbers of Americans believe that a key answer to our problem of gun violence is for more people to have guns. According to the Pew Research Center, nearly 6 in 10 Americans believe that the crime prevention benefit of owning a gun outweighs any risks. Let's see. We've already got 270 million guns in circulation, and that hasn't stopped the slaughter. Will another 100 million make us safer? 200 million? Apparently, when it comes to guns in America, enough is never enough. That's all for now. See you next time.